There is never too much talk about depression. There is continuous need to keep on raising the awareness, making people educated about the disorder, encouraging people to seek help. Why? Because it's one of the most common and one of the most debilitating conditions. At every given moment, about 5% of the population is suffering from active episode of major depressive disorder. That is huge. And your risk of developing depression throughout lifetime, even if you never had depression before, is 60%. If you ever had depression before, your risk of developing depression again is rising. And if you had more than 2 depressive episodes, we do recommend indefinite treatment with medications, because your probability that yet another depressive episode is going to come is over 90%. So we are trying to prevent new depression from happening, and we are trying to mitigate the intensity, the extent of disability connected to your depression. But depression is very clearly different than sadness. Sadness goes under the umbrella of normal human emotions, and we all can be profoundly sad and distraught if we are under that type of circumstances, if we are facing a life challenge, if we are facing loss, if you are facing disappointment, if you are facing failure. But 2 things are very important when we're trying to make a difference between sadness and depression. One of them is that there is usually no excessive feeling of guilt and worthlessness. So your self-esteem, no matter how distraught and sad you are, is usually not impacted. Then the second thing, you're usually able to meet at least some basic elements of your day-to-day functioning, easy taking care of yourself, your professional needs, social, interpersonal needs, you name it. You're able to at least do the bare minimum. A person with a depression tends to be unable to do so. Finally, there is a time criteria. Big life blow, a big hit, profound sadness, a huge loss can really incapacitate you. But usually within 2 weeks, we start functioning again. It starts being processed. We start getting better. When you are suffering from depression, one of the criteria is time criteria. You want to make sure that you're not jumping into conclusion, that you're not jumping into diagnosis, that at least 2 weeks of symptoms exist or more before saying, okay, now we really need to diagnose you with major depressive disorder. Also, before we do so, we want to make sure that there is nothing else going on that can present itself like depression. Thyroid function needs to be checked. We do need some basic labs. We want to make sure there is nothing behind the bushes that could be a medical problem and that could be a cause of your symptoms that we miss. We don't want to miss that, and we want to rule out medical conditions that can present as depression. And then to expand the knowledge about the fact that it's not about sad mood, although sad mood is one of the major criteria for depression, but you can just have this profound disorder of will and motivation, feelings of emptiness, inability to find joy in people, places, and activities that used to be joyful to you before, and we call that anhedonia. This usually comes with some type of sleep disorder. You're exhausted, you are suffering from low energy, but you cannot seem to be able to find that rest that is absolutely necessary. You have problems falling asleep, you have problems staying asleep, sleep is not restorative, or you are typically waking up very early, very depressed, ruminating about dark things on your mind and not being able to continue sleeping. You might suffer changes in appetite that are out of character, and you might gain weight or you might lose weight. And of course, if this is proceeding and impairing functioning more and more, you can sink into this inappropriate ideas of being worthless, not having anything to live for, having passive or active ideas of killing yourself or ending your life, being guilty for things that realistically are not consequences of your own doing. If this proceeds to severe depressive episode, it can show up with psychotic symptoms. So if it causes a breach from reality, you can start hearing voices. Usually these voices are in line with depressive thought content, usually a voice telling you that you are worthless, that you're useless, that you should kill yourself. Your capability to function goes down to the point that everything is not just difficult, but literally impossible. From high-level tasks, cognitive functioning is impaired. You can't really respond to all those emails. You can't think clearly. You cannot focus and concentrate. But to more mundane tasks, getting out of bed is hard. Putting clothes on is hard. Taking a shower is hard. eating, preparing food, cleaning your house is become unrealistic expectation. And sooner rather than later, you have to ask for help. Help is available. Depression is hard to treat. When you treat depression, most of the treatments that exist out there are approved on the basis of response, meaning that you do get better. But there is a difference between response, your depressive symptoms are reduced in the extent and intensity, recovery, meaning that you're back to normal, that you're not depressed anymore, that your depressive episode has resolved. So that is a clinical challenge. How do we help you reach that recovery, not just help you get a little bit better? So the goal of care should be recovery, not a response. And then what's the next step? How do you keep yourself well? Do you need to be on this medication forever? Initially, I would say no, but your goal of care should be to be on the medication for at least 6 months if you really are somebody who suffered major depressive episodes. And then the second one is, what do we do if you're not responding to medication? How do we augment treatment to achieve that recovery? It's really not easy because only 40% of people are going to be fortunate enough to achieve recovery with the first intervention. Sometimes intervention is not effective, sometimes intervention is not well tolerated. We have to switch medications around, we have to combine medications, we have to augment medications, and of course, therapy. There is no depression without anxiety, there is no depression without life hardship or life complexities, and using therapy together with medication treatment is the best possible approach. The other thing that is very important is preventing a poor outcome, preventing death, because depression does come with suicide, and depression is a potentially deadly psychiatric condition, not only due to self-harm, but also due to the fact that when you're depressed, you don't take good care of yourself, and your risk of getting sick with other medical illness is increasing. Good news is that there is hope. Good news is that there is abundance of treatments out there. There are antidepressants, first, second, third, fourth line of treatment, combinations of medications, augmentation with antipsychotics, augmentation with mood stabilizers, augmentation with hormones. There are interventions that are proven to alleviate depression. CAT transcranial magnetic stimulation, ECT. Point is that there is such a long road when it comes to treatment, that there is so many options that I would argue there is a possibility for absolutely everybody to get cured, to reach remission, and to be depression-free. If you are actively depressed, you are by definition discouraged, and you do not believe that this is a possibility. As a board-certified psychiatrist, I'm guaranteeing you that this is not a possibility, this is a fact. And I am encouraging you to make the first step, to seek for help, and to embark on this journey of getting yourself better, because it is important for you. But the moment you help you, it is important for everything and everybody around you. When you're less depressed, you help yourself, you help your loved ones, you help your romantic partner, you help your kids, you help your parents, you help your colleagues, you help your neighbors, you help your employer. Because a non-depressed you is a whole different person and can function at a way superior level, and you deserve that. So please, if anything about this conversation rings a bell, do not hesitate to make that first step, seek help.